Hello everyone, I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Okay, we have some quiz on cervical carcinoma in the form of true or false. Okay, so choose the one best response. Is it true or false as regards cervical cancer? Okay, let us start with the first one. And before I start, please try to answer before me and give yourself a score out of 1 for each question. This is 10 questions, so the total score would be 10. Okay, and please write your score in a comment, and if you have any query, write it in a comment also. Okay, but please in each question try to answer before me. So we'll start right now with the first question, and I said 1 mark for each one. The human papilloma virus may cause cervical cancer. The human papilloma virus may cause cervical cancer. True or false? Of course, human papilloma virus is considered an important cause for cervical cancer, so the answer is true, yes. And you can find DNA of human papilloma virus in more than 90% of cases with cervical cancer. So, yeah, it is a cause of cervical cancer. So, this sentence is true. Second one. Cervical cancer is often asymptomatic. Cervical cancer is often asymptomatic. True or false? Okay. Try to answer before me. Okay. Yes, cervical cancer is often asymptomatic in early stages. Okay. So, in early cases, early development of cervical cancer, it is microinvasive, and it sometimes remain asymptomatic, no symptoms at all. And this stage is diagnosed during the screening program. So screening not only for diagnosis of CIN, but also for diagnosis of microinvasive cancer, because there may be no symptoms, so the patient will not go to ask medical advice from a gynecologist because she don't have any symptom. But if she have postcoital bleeding, the gynecologist will search for cervical cancer or CIN. But if she is asymptomatic, she would be how can she be discovered during screening program? So cervical cancer is often asymptomatic, yeah, in early stage. True. Next sentence. If a patient had any type of hysterectomy, she can't get cervical cancer. If a patient had any type of hysterectomy, she can't get cervical cancer. True or false? Okay, you should think about this. Okay, try to answer before me. Yeah, this is false. This is false. Why it's false? Because not all types of hysterectomy, including cervix, because there is what's called subtotal hysterectomy or supravaginal hysterectomy. The doctor leaves the cervix. So I can't accept this sentence if there is this word any type of hysterectomy. Any type of hysterectomy. Okay? So that's why this sentence is false. So yes, she can get cervical carcinoma as in cases of supravaginal hysterectomy or subtotal hysterectomy because there is cervical stump. So, as regard if a patient had any type of hysterectomy, she can't get cervical cancer. This is false. Okay, go to the next, please. Human papillomavirus infection must be treated to help in prevention of cervical cancer. Human papillomavirus infection must be treated to help in prevention of cervical cancer. True or false? It is false. Really, it is false. Why? Because I'm not going to treat human papillomavirus because it is treated by the person, the immune system of the person herself. So the woman herself spontaneously with her immune system really clear the human papillomavirus infection within 8 months or maximum within 2 years. In adolescent age and in young ladies, all the infection is cleared within 8 months. Okay, so it is treated with immune system of the body. So and this treatment, so there is no medical treatment. I'm not going to give the patient medical treatment. Okay, so this sentence is false because I'm not going to treat human papillomavirus infection to help in prevention of cervical cancer because it is cleared spontaneously by the immune system. Okay, let us go to the next. Cervical cancer can often be prevented. Cervical cancer can often be prevented. True or false? Yeah, cervical cancer can often be prevented. It's true. It is true. Yes, it is true. How it is prevented? By screening program, by doing screening program like BAP test, human papilloma virus test. Okay, this screening program help to diagnose the pre-invasive lesion, the pre-cancerous lesion, which is the CIN. The second important item in prevention of cervical cancer is human papilloma virus vaccine, like Gardasil, like Cervarix, and so on. This vaccine also can prevent cervical cancer. This human papillomavirus vaccine can prevent cervical cancer because we said before that human papillomavirus is considered a cause for cervical cancer. So if we can give vaccine for human papillomavirus, we are preventing cervical cancer. So cervical cancer can often be prevented by screening program and by human papillomavirus vaccine. So this sentence is true. Go to the next. Women with a uterus need to get pap test every year to check for cervical cancer. Again, women with a uterus need to get a pap test every year to check for cervical cancer. True or false? Try to answer before me, please. This is, of course, false. Why false? Because I'm not going to check pap test every year. It is done every 3 years. And if I'm doing a human papillomavirus with human with the pap test, can be done every 5 years. So I'm not in need for every year to consume the effort and money, and maybe the patient will be confused with some false results. So it is not done every year. It is done every 3 years, starting from certain age, as we will see. Okay. So as regards this word, this false, because we are not going to do it every year. The pap test, if it is done every 3 years. Okay, next, high risk types of human papillomavirus which may cause cervical cancer include human papillomavirus 16 and the human papillomavirus 18. True or false? Of course, it is easy. Yeah, it is true sentence because yes, 16 and 18 is the most important serotypes of human papillomavirus that cause cervical cancer. And 16 is more dangerous than 18 also. Okay, it is found in more cases. So this is true. Next, human papilloma virus vaccine only work to prevent human papilloma virus infection and not treating an infection. Again, human papilloma virus vaccine only work to prevent human papilloma virus infection and not treating an infection. Is that true or false? Yes, it's true. It prevents. It is not treating. The vaccine for prevention of infection, not for treatment. So this sentence is true. Okay, next. Surgical treatment is the first line treatment in stage 2B cervical cancer. Again, surgical treatment is the first line treatment in stage 2B cervical cancer. True or false? Okay, 2B is not an indication for surgical treatment. It is indicated for radiotherapy. Okay, so this sentence is false. Yeah, so the ideal for 2B is to be managed by radiotherapy. Women with a cervix at average risk should begin cervical cancer screening at age 25. Women with a cervix at average risk should begin cervical cancer screening at age 25. True or false? Of course, it's easy, yeah. It's true. Should start screening program at 25 years old. That's right. This is the last question. Please write your score at the end out of 10. 1 mark for each sentence. So total of 10. So give me your score out of 10. And this is my 6 books published on Amazon: textbook of obstetrics, textbook of gynecology, contraception handbook, multiple choice question book, medical disorder in pregnancy, and the gynecologic oncology book. And this is my site on Amazon. As an author, you can find my books on Amazon on this link. I write it on a comment also, and in the description. And this is my site on YouTube, where you can find more quizzes and more lecture on OB Guide. Thank you, everybody. Wishing you all the best.